But what types of roles? Because I look at, the amount of people that are willing to work, searching and applying, right? The active market, that's supply, and jobs are demand. So right now, what are you seeing as roles or markets that are critical needs right now, the highest demand?
This is Claudia. Here at Atlantic, we are looking at a lot of different types of roles. Of course, the most obvious one is that critical care nurse, the ED, the ICUs, where we can, it's where we're looking to fill as many as possible. We are looking also at respiratory therapists as a critical need, as well as positions in our lab. We need to get those tests through. We need to get those tests done. So that's a hard to fill right now. And we're also concentrating on food service and environmental. So
I was going to say, in addition, so we're looking for healthcare professionals too. Obviously, I think some people don't know that maybe extensively about CVS Health, but we're also looking for, infusion nurses. We're looking for LVNs and LPNs. So we're also in that market. But, for critical needs, it's like what Ashley said earlier. It's also those frontline people. Those are really important to the people who are talking with our members, who are answering their questions, the farm techs who are getting you your prescriptions, the delivery drivers who are dropping them off, the distribution centers that are trying to keep up with that demand for products and services. So those really across the board are real critical needs for us to keep those supply chains going and keep serving the communities we have.
Yeah, I mean, I would, I'm sorry, this is Clay again. I mean, I would have to agree that when you're looking at, what the critical needs are, of course, it's going to be that clinical person, but that it's just an effect of, we need everybody. We need as many people as we can, because you may not be in the clinical world, but it's a domino effect where we're going to need more people to support those folks in the clinical world. So our list changes every day. Our hard to fill list changes every day. And so our focus, changes every day. So it is certainly not the norm right now. It's exciting, but it's not the norm.
Yeah, I think that's an excellent point that we're hearing here, is that critical needs are, yes, we know there's a talent gap and it's difficult to hire doctors and nurses, and of course they're in need, but all of the supporting staff that goes around the healthcare, the ability to provide care. I loved Ashley's example too of those service reps that are working the front line to help people directly with their need to speak to someone. That there's a big supporting workforce around providing healthcare that is not just the clinical roles. I think that's really great to point out that there are other areas that are in high demand as a result of that.